Hello and welcome. This is an information session for the Temple College Dental Hygiene program. My name is Melissa Mahalik and I am the program director. So a little bit about what is a dental hygienist and what do they do. We are a licensed dental professional. We are the prevention experts of the dental team. We educate patients, teaching responsibility for their oral health and general health relationship. We are the ones that remove the hard and soft deposits from the teeth. We are able to apply fluoride, sealants, and we do expose x-rays or radiographs. We also can provide nutritional and tobacco cessation counseling. We also educate in the community. So this slide shows a good example. I know it's from 2019, but it's still pretty relevant as to where most hygienists are employed. And if you look at the screen, it actually shows that about 85% work in private practice, and then about 10% work in corporate dentistry, which that might have changed somewhat. Maybe this 10% has gone a little higher due to the fact that a lot of the dental offices around are now corporate. So that might be a little different, but probably 95-ish% are in some sort of chairside care. Other areas of work with further education could be teaching or working in a dental school or dental hygiene school, possibly community dental hygiene, management and consultant positions, supply representatives or sales, such like, if you work for Crest or Colgate, those types of places. And even with more advanced degrees, research and possibly working in a hospital facility. This is from January of 2024, a survey, and we would be considered as far as our median salary for Arkansas, Louisiana, Oklahoma, and Texas. If you're working full-time, around $42 an hour, or approximately $70,000 a year. Now, depending on where you live, what size city you're in, it may be higher or lower, but that is a good starting point there. You also have to meet specific essential technical standards and qualifications in order to become or be a hygienist. You need to be able to work with people. Communication is one of our core competencies. You need to be able to converse chairside with a patient. We do not discriminate with our who we treat. You've got to have good critical thinking skills, reading comprehension and applying what you've read, good visual acuity, and good interpersonal abilities. We do have a code of ethics, and we have to display good judgment and be able to function under stressful conditions. We also need to have good hearing or auditory abilities, be able to have gross motor skills such as balance, hand-eye coordination, flexibility in confined spaces. Typically, our dental hygiene operatories or rooms are not very large, so you need to be able to work in those smaller areas. Also, our fine motor skills are very important. That's we use our hands, wrists, that type of thing, and so you've got to be able to have good movement with all of those. And then physical endurance is also needed. You can sit for long periods of time chairside. You are going to have some repetitive movements. You need good upper body strength. Again, like I said previously, use of hands, wrists, forearms for extended periods. You do twist and bend at the waist a lot. Well, not a whole lot, but you need to be able to do this. If you have any kind of back pain, this is probably not something you would be successful at for very long. And then also stay on a schedule, so complete tasks in a timely fashion. So about our program, it is accredited by the American Dental Association's Commission on Dental Accreditation, which is CODA. Our students do graduate with an associate's degree in applied science. We select 16 students each spring, and we continue to have very strong board results. So if you're interested in applying to the program, of course, watching this information session is mandatory, and there's also a quiz at the end that you will need to submit in order to receive your application. You will need to apply to Temple College for sure, and do that first, and then send in any other transcripts that you've had from other colleges into our admissions and records department, as well as sending an official transcript to our Temple College Dental Hygiene department. So those two transcripts need to be submitted prior to application. Also, you must have taken microbiology, chemistry, anatomy, and physiology 1 and 2 within the past 5 years in order to apply. If your courses are older than that, then you would need to retake them. And our application deadline is now January the 31st of each year. And that means we must have your application in our possession no later than January 31st each year. So when we look at the different components for our selection, you must of course be a high school graduate or Texas Certified High School Equivalency or GED, a 2.5 GPA or higher. All of your prerequisite sciences must be completed prior to that January 31st deadline. And on these prerequisites, in order to score higher points in your application, those need to be very good grades. Let's see, official transcripts, that's what I just went over. We need 2, one to my administrative assistant, Mrs. Laws, and one to our admissions and records office. We also are required to have you take a standardized test, and that can be taken at our college testing center. The test that we require is our ATITs. You can take that 2 times in an application period, which is July 1st through February 1st. Actually, it should be January 31st if you're going to submit that year. So July to February is the time frame, application period, and you must make at least a 65 overall composite score. That is to actually have a complete application. Currently, our selection committee, we are finding that the higher T-score is what's helping students become more successful as far as points on their application. Probably 80 to 85 or higher is what we would consider competitive. So if you make the 65, yes, you'll get you can submit your application, but you probably need to retake it to try to gain points in that area. So a little about the TEAS exam. Make sure to take the TEAS for allied health. There are some out there floating around that's for nursing, and some students have mistakenly taken it, but it needs to be the ATITs for allied health. Make sure you do invest in a study guide. Do not wait until the last minute to take the test. And your scores are only good for 1 year. So if you don't get in the year you apply, and you might have to retake, or you do have to retake it for the next time you apply again. So if you reapply, you must retake your TEAS exam. We also require observation of a dental hygienist. You can find these pages on our printable application procedure tabs on the web page. It's a drop down and you can print those out, as many as you need. They must be our Temple College observation forms. They cannot be from another college that you're applying to. It needs to be specifically the one that we have posted there on our web page. You need 16 hours of observing a dental hygienist, not a dentist. It's a minimum of 2 separate dental settings. If you work as an assistant, yes, that can be one of your settings, but you must do one outside of where you work or more. Let's see here. And the next one is previous dental experience can be used, but must be verified by the employer. And like I said, it only counts as one of the settings. If you are reapplying, again, not only do you have to retake the T's, you must have new current observation forms sent in with a new application. So that's one question that we get a lot is, do I have to do more observation? The answer to that is yes. Other things that help you increase your points for consideration into the program would be any completed co-requisite course, which could be any of the following: speech, communication. And if you're looking at a speech course, the one I would prefer that you take is interpersonal communication, which is speech 1318 here at Temple College. But we do accept any of the speech courses that are listed in the catalog. But the one for interpersonal communication would probably be the best one to help you chairside with patients. Also sociology, and then there's a language elective for language, philosophy, cultural creative arts, psychology, and English Comp 1. We also offer a dual enrollment. Once you're enrolled in our program, that you could complete your bachelor's in dental hygiene simultaneously as you're getting your associates in applied science here at Temple College. If that is in your future and you want to complete your bachelor's, you might want to also consider taking statistics, federal government, and then composition to English. That will help you with your TWU courses. So it's very important to apply to Temple College prior to turning in your dental hygiene application. We need to see that you are you have registered here and we have something to connect your records to, basically. There is no application to apply to Temple College. Admissions and records can verify transferability of previous courses taken, say at another school. You can have them look at your courses, and then if they're unclear about it transferring, then they will contact our department. So the top 30 applicants move on. We rank them once all the applications are in January. We rank them 1 through however many we get, and we'll take the top 30 objective scores and move on to interviews, a writing sample, and a dexterity exercise. Once interviews are completed, you will be notified, usually early March, that you have conditional acceptance. That means that we'll accept you, but then you have to choose, you have to let us know that you choose our program. So also we do continue on past the top 16, and there is an alternate list that we will sometimes have to move into if we don't have the top 16 accept into our program. Again, if you're not accepted into the program, you may reapply, but you are limited to 3 attempts total. Once you have been conditionally accepted, you must also submit some more documents to us. These include your immunizations, and the ones listed here: TB, HBV. This is your hepatitis B and titer. And what we need to know here, a lot of students are confused here what this is. Most students now have been vaccinated for HBV as an infant or childhood, and that vaccine basically is not vital anymore. So you don't have enough antibodies to prevent you from getting the disease. So you'll need to have a titer, which is a blood draw, and they will check to see if you still have that vaccine available or that antibody available in your system. If not, then your doctor will talk to you about the next steps. And then the MMR and the meningitis. We'll also give you information how to go about getting your criminal background check. And then there'll be a form that's sent out to you also that you need to read and sign about the technical standards and qualifications form. So a little bit about dental hygiene school. It is very time consuming. Of course, it is science heavy. It requires serious life and financial planning. So pay attention now. I've got a slide coming up. We're going to talk about the financial part. You know, you've got to be prepared for what the education cost. You must have very good organizational skills. It's a lot, very intense, much to learn in a short time frame. Working is strongly discouraged. You can work, but if you start struggling, then we may have some discussions with you about how much time you're committing to your education. So expenses, it's also in the information packet that you can also download from our webpage. It's under application procedures. That's where all the downloadable documents are. But there's additional cost for obtaining your license that aren't educational as far as Temple College goes. So there's also a national board exam. That's a written exam. You have a clinical regional board, is a clinical exam. You have a jurisprudence exam, which is a state exam, and then your licensing fee. And you'll have to pay for all of those things prior to getting a license. And you're, of course, not allowed to work until you have that license. So here's our estimated cost of the program. And I've highlighted in green, most of our students are out of district, so I've got that as a total of $22,978. And of course, these are all approximations, depending on, you know, if you get a used book, textbook, new textbook, tuitions and fees sometimes change slightly over time. We do have in-district, and those would be those people that live in Temple and pay Temple College taxes. So that would be the difference there, is if you are in district or out of district. So anywhere from $22,000 to about $23,000 for the 2 years of the program is your cost. I do have noted here in yellow, in this little red area here, it's approximately $2,300 additional to obtain your license, and that includes these items here, which were mentioned on the previous slide. These are outside of what it costs from Temple College. So about $2,300 of that total is actually your licensing fees and things like that. So just make sure that you're aware. This is also downloadable, this form. I know it's hard to see on the screen, so I would download it and print it off if you want to look at it closer. Also, we have to let you all know that we are working with bloodborne pathogens. So this is something, if you're scared about that or something like that, we have to present this to you and say that, we do follow all of the CDC and OSHA bloodborne pathogen standards for protection, just like any other medical profession. We also have to present this to you. It's our policy and procedures relating to individuals with bloodborne infectious diseases. So yes, you will treat anyone that comes through the dental clinic. But again, there are some stipulations that are mandated by government agencies that, if someone's active with, say, let's just throw out TB, we do not treat an active TB patient, but once they have been cleared, we would treat them. So anyway, this is a lot of reading to do. You can pause the video and read it if you'd like. It's also in our policies and procedures manual that you'll read when you get here. So just to be aware, a lot of times people think we're only doing polishing as far as our what we do in the clinic or at chair side, and that's this, like something like this beautiful smile right here. And in reality, what we are removing are what's under the gum line, what's above the gum line, and this is all calculus or tartar as people call it, that can be removed, and it's very detailed procedures that we utilize to remove these particles from the teeth. So you will be seeing all different levels of patients, from this beautiful smile into this periodontal type patient here. So we begin our classes in the summer. The year that you apply, we start that following summer, and we have 2 days of orientation. Typically it's the 3rd week of May. There's 2 days of orientation. Then we we start our summer courses. That is Dental Hygiene 1227, Preventive Dental Hygiene Care, and Dental Hygiene 1301, which is our oral anatomy, histology, embryology, and head and neck anatomy. We also will have group CPR certifications every June. So even if you've taken CPR and you're current, we will have you attend our classes together, just because of monitoring everyone's CPR certifications and keeping you current. So submitting application. The sooner you get all of your documents in, the better you'll feel about it, first off, and you won't be scurrying around at the last minute trying to meet with my admin assistant to see if you've gotten everything in. So submit all your documents as soon as you have them. Again, this is the application, the transcript from every college attended. That means any place you've ever taken a college class. Your observation forms, your T-scores. If you did not take them on the Temple College campus, then they have to be sealed and stamped in an official envelope before they are sent to our campus, as well as to Mrs. Laws. You can check with her, say you sent it in to her 1 week, and I would put a note to check back with her the next week to make sure she's received all your documents, because just because you put them in the mail, they may not get to us. Sometimes mail is very slow. We also have a drop box outside our building that's available after hours. It's mounted on the wall of our building by the big doors, and you can drop off things. I would put them in like a manila envelope or something and seal it, and double check with Mrs. Laws the next day or two that she received those out of the drop box. So sometimes students would prefer walking them up here, dropping them off, rather than putting them in the mail. So if that's convenient for you, I would probably recommend that if you can't get here during business hours, to drop it off. So if you have any questions, here's the contact information. Mrs. Laws is my administrative assistant, and here is her email, which is rosemary.laws@templecollege.edu, or her phone number is 254-298-8667. And again, it's best to reach her by email, and she's pretty quick at returning all emails that she receives. There's also a list here of our website at templecollege.edu. You would select programs as health professions, and then dental hygiene, degree, and certificates. We did have a complete clinic renovation this past summer of 24. So this is a picture, a snapshot of our current clinic. It's very nice. All of our equipment is new, up to date, state of the art, chairs and equipment. So this is a glimpse into our dental hygiene clinic. So after you've viewed this PowerPoint, you will need to complete the certification of attendance quiz, and then you will receive your application for our program probably within the next business day from Mrs. Laws. But if you do this on the weekend, it's probably going to be Monday after that before you hear back from her. But it is not an automatic. It doesn't automatically come back to you. She will physically send you that email with the application attached. So there, I have her email listed there. So anyway, well, I hope you got the information that you were looking for, and we look forward to meeting with you and talking to you soon. Thank you very much.